Assalamu alaikum fourth year. This is our first lecture of PT1 and that subject is composed of two indifferent subjects, and these are physical rehabilitation, neurology and regional therapeutics. So the topic we will discuss is TBI, traumatic brain injury. So let's start this topic with a definition of traumatic brain injury or TBI. That is an insult to the brain that is caused by an external physical force that may produce a diminished or altered state of consciousness that results in an impairment of cognitive abilities and physical functioning. And it can also result in disturbance of behavioral and or emotional functioning. So introduction of this topic is TBI describes a wide range of condition, and it has in the past been used interchangeably with the term head injury. That is also accompanied by other types of injuries, particularly a fracture. So the fracture of skull can be simple or compound, undisplaced or depressed. So the damage to the brain may be caused by either at the time of injury, that is primary, or as a result of other types of complication, these are secondary. So primary injury is pathophysiology of TBI. Primary injury is direct blow, direct trauma to the parenchyma of the brain. So as a result of primary injury, there will be secondary complication that we will call it secondary injury, that results from a cascade of biochemical, cellular or molecular events that evolves over time due to initial injury and injury related to hypoxia, edema and increased intracranial pressure. So we are discussing the pathophysiology, the causes of TBI. So the causes involved acceleration or deceleration that causes shear and tensile and compression forces within the brain. So these forces causes diffuse axonal injury, that is most common mechanism involved in TBI. Now the mechanisms of TBI, four main mechanism of brain injury. Brain contusion, that is number 1. Number 2 is increased intracranial pressure. Number 3 is diffuse axonal injury, that is most common mechanism. And number 4 is stroke, ischemic or hemorrhagic. So number 1 mechanism is brain contusion. Brain contusion is defined as cell death accompanied by hemorrhage, leakage of blood. The soft tissue within the brain that is vulnerable to contusion in head trauma. The contusion often occurs at a site distant from point of impact, that is as a result of counter curve. Mechanism number 2, that is increased intracranial pressure. Intracranial contents are 80% brain tissue, 10% blood and 10% cerebrospinal fluid. And increase in volume of any of these may raise the intracranial pressure. So as a result of increased intracranial pressure, there will be brain swelling, edema and excessive blood, accumulation of excessive blood. And also the cerebrospinal fluid can accumulate due to blockage of outflow. So the causes of increased intracranial pressure are epidural hematomas and subdural hematomas, and swelling of the brain that can be observed on CT scan. Now the mechanism number 3 is diffuse axonal injury, that is one of the major cause of unconsciousness and persistent vegetative state, that is comatose state or we can define vegetative state as a minimal conscious state, and in a vegetative state there is disassociation between wakefulness and awareness. So this mechanism occurs in up to 1 by 2% of traumatic brain injuries, and this is a diffuse form of injury, and meaning that damage occurs over a widespread area than in focal brain injury, and that it is almost impossible to detect diffuse axonal injury. And number 4 mechanism is stroke, that ischemic stroke or hemorrhagic stroke. So ischemic stroke can occur in trauma secondary to swelling which compresses nearby vessels, and in case of hemorrhagic stroke that can occur as a primary or secondary injury. Okay, for here up till now we have discussed the definition of TBI, then introduction and causes, pathophysiology of TBI, where we discussed 4 main mechanism, and most common mechanism was diffuse axonal injury. Now let's begin the 3 categories of TBI, that is mild, moderate and severe. So based upon loss of consciousness and post-traumatic amnesia and Glasgow Coma scale. So let's describe these terms first. What is PTA, that is post-traumatic amnesia? That is length of time between injury and the time at which patient is able to remember ongoing events. So that is post-traumatic amnesia. And what is Glasgow Coma scale? That scale is used to measure the consciousness of the patient, where highest score is 15 starting from 3. Okay. Now the 3 categories of TBI based upon loss of consciousness, post-traumatic amnesia and Glasgow Coma scale. So mild TBI is when the score of Glasgow Coma scale is 13 to 15. Loss of consciousness is from 0 to 30 minutes, and the PTA is for 1 day. Post-traumatic amnesia is for 1 day in case of mild TBI. So in case of moderate TBI, where Glasgow Coma scale is 9 to 12 and loss of consciousness is greater than 30 minutes and lesser than 24 hours. Post-traumatic amnesia in case of moderate TBI is greater than 1 and lesser than 7 days. Now in case of severe TBI, where Glasgow Coma scale is lesser than 9 and loss of consciousness is greater than 24 hours and post-traumatic amnesia is greater than 7 days. Boys and girls, the rehabilitation of patient with a neurological condition does not involve only one discipline, it involves more than one, and these are occupational therapy, physical therapy and speech therapy. So they make plan of care according to the impairments of the patient, and the impairments that are associated in TBI, these are categorized into 3 main types. These are neuromuscular and cognitive and neurobehavioral. So in case of neuromuscular, there is paresis of muscles, that is partial loss of strength in muscles, abnormal tone in muscles and impaired coordination of muscles. And in case of cognition, that is a mental process of applying information, there will be impairment in attention span, concentration and memory and learning process. In case of neurobehavioral, there will be agitation and emotional liability, irritability, and mental inflexibility of patient with TBI. So here there is another condition, that is dysautonomia, also called as paroxysmal sympathetic hypertrophy. So what happened in case of dysautonomia? Here there will be elevated sympathetic activity following TBI. So elevated sympathetic activity following TBI is dysautonomia, and what happened that results in increased heart rate, increased respiratory rate, increased blood pressure, and increased temperature of the body, hyperthermia, and decorticate posturing. So incidence of dysautonomia is 8% to 33% in patient with TBI. So that's the end of today's lecture. We will cover the remaining part of this topic in coming lectures.